The time has come to just ask a pro. If you have any questions about urinary tracts, bladder function, anything like that, we have the doctor from Granger Medical Summit Urology here, Dr. Parkinson. How you doing?
Doing well, thanks.
I guess you were listening a little bit earlier, and you heard the story about the guy they had to get the padlock out of.
I did. Interesting story.
Do people actually do stuff like that come in and see you?
Well, we on occasion get to pull a lot of interesting things out.
Yeah.
I'm guessing this guy must have known who had the key to the lock, and maybe it was placed strategically.
You know what? You might be
Possibility.
right.
Maybe.
You might be right.
I just can't believe people do that.
Well, do you
for real.
ever go and retrieve kidney stones in that way?
We do. Certainly, certain kidney stones, depending on the size, that's the best way to retrieve it, but you get to be asleep for that.
Okay, because I heard that I was in your office once, the one on Highland Drive, and there was an older gentleman in the room next to me, and it sounded like, from just me hearing, sounded like they just went in and grabbed it. And they go, okay, how do you feel now? And I was like, wow, that was interesting.
That would be interesting in the office. I think I would choose to be asleep for that one.
Yeah, no kidding.
Because I've done stints, had hundreds of kidney stones, and so I'm a professional at the whole urinary tract stuff.
How did those stents treat you?
It's weird. I thought it was falling out of me once, and that's the day I went into, and I heard the guy as I thought it was falling out, but it wasn't. Just weird.
Just felt something weird.
Yeah, felt different.
So what is the normal? I mean, not normal, I guess, but what are things that can go wrong with the bladder? I mean, you think of like, I can't go, or I can't, that kind of stuff. Or what are the things that that you normally see?
The urinary system tends to be one of those things that you only notice when it's not working right.
Right. Yeah.
Right,
Ooh, that burns, or something. Yeah.
Ooh, that burns, or I know where every bathroom is, or
right.
I don't go to a store unless I know it's got access to a bathroom, those type of things.
Gotcha.
And so when the urinary system is not working well, people tend to notice it a lot. Waking up too much at night sometimes is a symptom that people will experience with this. There are a lot of different things that go into the urinary function and whether or not it's appropriate. One of those is kind of how often you have to go. Another one is how much urgency there is when you do go. I often talk to some of my patients and say, if you've got that urgency that says, I can't make it to the next commercial break, that's probably more urgency than is normal.
Gotcha.
If
Okay.
you've got urgency that gets you through the next commercial break, that's probably a pretty normal thing.
Now, I mean, most of the stuff you hear is if you have to go too often, you could have a prostate issue or that kind of stuff as men, I guess. But that's not always the case, right?
Interestingly enough, if you look at men who go too often, probably around a 50-50 breakdown. 50% of them, it's because the prostate's enlarging. 50% of them, it's because their bladder's a little overactive. For years and years and years, we kind of treated all men the same, which was if you have to go too often, it's your prostate. Well, it turns out about half the time you're right, about half the time you're wrong. So it makes some sense to think about the bladder as a problem as well.
Is there something that men do that make their bladders not work right?
Nothing specifically. We always do want to talk to anybody who comes to the office that has issues with urination about certain habits. How much do you drink? How much fluid do you consume? How much caffeine is there in your diet? And all those things will contribute to urinary frequency. But for the most part, when your bladder's overactive, a lot of times it's independent of what you're doing.
Okay. And do you suggestion like there's certain things like get a colonoscopy when you're 50? Should somebody just call Granger Medical up and just do a checkup for your urinary tract, everything, if nothing's even bothering you?
But does the colonoscopy even do anything for that? So does it check the bladder too?
Colonoscopy will mostly check the colon,
okay.
But there are screenings that we want to do for men even without symptoms. And so it's important to notice at about the age of 50, we're going to want men to come in and get their PSA checked and check them for prostate cancer. And so we like to do screenings on men at about the age of 50 for prostate cancer, but specifically concerns about the bladder. If your bladder doesn't bother you, your bladder doesn't bother me. So if you're not having bladder symptoms, you don't necessarily need an appointment just to check to see if your bladder's okay.
How big is your bladder?
Bladders will change in size. The biggest bladder that I've seen had about 4 liters of fluid come out through it, but that's not normal. Normally a bladder will hold somewhere between 300 milliliters and 500 milliliters, so maybe about 32 ounces.
But those times like at the end of the concert when you go into the restroom and you feel like you stood there for 10 minutes.
Yeah.
And you're like, oh my gosh.
How many times should a healthy man urinate in a day?
So usually we look at that, and there's a pretty wide range. anytime you're getting into the point in time where you're going more than maybe 7 or 8 times in a day, and it bothers you, we would consider that to be abnormal.
Okay.
Getting up more than once or twice at night tends to be abnormal. And a lot of times guys notice how many times they're getting up at night. Don't really notice how often they're going in the daytime, but they notice when they're getting up at night.
Yeah, 'cause you trip over the dog and you bump your knee on the
And
But 2 is okay.
Couple times.
A couple times is okay.
If it doesn't bother you.
Gotcha,
If
okay.
it bothers you, like I said, with the bladder at least, if it bothers you, it bothers us, and we'll do what we can to try to get all those symptoms under control.
Gotcha.
Okay. Another question, what if you find things in your urine, and should you, or is there anything that might be somewhat normal? Like, blood, I mean, usually is what I would look for if I have a kidney stone. Sometimes I see kidney stones come out, and sometimes I see other stuff too, like it's almost like Jell-O.
Green Jell-O?
No, it's not green. It's clear. It looks like tapioca.
Carrots?
And no carrots.
We're on the same, yeah.
Okay, if it's not green Jell-O with carrots, you should be good. No, in all reality, urine should be clear. And so anytime someone has blood in the urine that they can see, definitely that warrants a phone call to either their doctor or even getting in to see a specialist.
What about even just like the dark color?
Dark color, there are certain supplements you can take, things that have vitamin B in them that can make your urine get a little bit darker in color. But if urine changes, you should be seen. So if you're used to having a very clear urine and it's gotten darker, sometimes that darker urine can mean that there's a little bit of old blood that's there. So it's important if the urine color changes and it's something you're not used to seeing, you should be in and be seen for that.
And usually I've noticed that blood's not red when you urinate it, it's brown, usually.
That is most common.
Yeah, and so it's like I have so many kidney stones.
I feel like I don't know if it's off topic because it's kind of topic, but should I ask this? How come, like, if I eat like sugar smacks or sometimes coffee, that your urine smells like that?
So lots of the different aromatic chemicals that are in our diet. The best example of this is asparagus, right?
Yeah.
Right.
Anybody who eats asparagus gets the asparagus smell, right? And so there are certain of these aromatic compounds that actually will get excreted through your kidneys right into your urine.
So it just goes right in. Gotcha. Yep. Yeah, because if I have like sugar smacks, I'm like, yep, had sugar smacks.
We have Matt on the phone, wanted to ask you a question. We're talking with Dr. Parkinson. He is from Granger Medical Summit Urology. Matt, what is your question for Dr. Parkinson?
Hey, Doc, quick question. I was wondering what causes kidney stones. I've heard a lot of jargon about it being caused from soda pop or caffeine or energy drinks, and all of which I consume regularly. So in the trying to save myself a lot of pain, if I needed to refrain from that stuff, just wondered what causes those.
Good question.
That is a great question. We oftentimes say that the solution to pollution is dilution when it comes to kidney stones. What that means is the more fluid you consume, the more dilute you make your urine, the less likely you are to form a kidney stone. But there are certainly some things that you can drink in your diet that will increase your risk for stones. Caffeinated beverages do tend to contribute to stones because caffeine acts as what's called a diuretic. Diuretic means it makes your body make more urine than it wants to. And then eventually you have to make up for that, so the urine becomes a little bit more concentrated. Dark-colored sodas are usually a little bit worse than the lighter-colored soft drinks because the way that they are acidified is with carbonic acid instead of citric acid. So there's a lot that goes into it, but there are essentially 5 things that we know of in the diet that will reduce your risk for stones. Number 1, the amount of fluid you consume in a day. You want to be able to make about 2.5 liters of urine in a day if you're going to avoid kidney stones.
Like water fluid or any fluid?
Can be any fluid,
Okay.
but I tell folks that try to at least make half of that water.
Gotcha, okay.
Because if I get someone to give up the soda and they don't replace it with another fluid, then they become dehydrated, and dehydration is another risk for a kidney
Gotcha.
stone.
Okay, yeah.
Second one is to watch your salt intake. We know that with increased salt intake, you increase your risk of kidney stones. Third one is you want to have a normal amount of calcium in your diet for a variety of reasons. You don't want to cut it all the way out. You don't want to go overboard with it. And then the last one is that anything that's got citrus in it, so citrus fruits, citrate, when it makes it into your urine, helps to stabilize calcium so it can't form stones. So lots of things that can help you prevent stones. And if you can institute all those things, about a 70% reduction in forming stones.
Wow.
What about spinach?
Spinach has a lot of oxalate in it. Most times kidney stones are made out of a combination of calcium and oxalate together. When you get calcium and oxalate together, that's what causes a kidney stone. So we usually ask folks when they have a high oxalate diet, spinach is high in oxalate, to kind of reduce that to some extent, to reduce the risk for stones.
And how should a guy like Matt, who's experiencing kidney stones, should he do that 24-hour urine test?
I strongly recommend the 24-hour urine test for anyone who's formed more than one kidney stone, because then we can go in and we can specifically design for you a diet change or a medicine to help reduce your risk for stones.
Have you done that, Matt?
I have not, no, and I haven't experienced any of that. My brother actually did this past year, so I got to see firsthand how much fun that was for him.
Yeah.
So I'm just trying to avoid anything that might cause that to happen in my kidneys. So I appreciate that. I actually do balance it out with a lot of water as well. I don't know if that, like you said, the balance of fluids. But
a lot of fluid.
I try my best to kind of make about equal parts, beverage to water. So
yeah,
and
try to stay away from the soda pops, the darker colored ones. I do really good, and then I go bad, and then do good, and then go bad. But I'm really stressing the water. I'm up against a hard break. We got another question we'll take off the air right here. But doctor, would you say anybody should do a checkup?
I think anybody who's got concerns that their bladder is not working the way they want it to, get in and be seen, because we have ways to fix these problems.
Cool.
You don't have to live with it. A lot of people think it's because I'm aging, or it's because of this, or it's because of that. We have ways to fix these problems. Get in and be seen if it's bothering you.
And awesome. That's Granger Medical Summit Urology, 801-266-8664, summiturologygroup.com. Thank you, doctor.
Thank you.
It's a pleasure. It's Mick And Allen. We'll be right back on KBER 101.